Everyone, my name is Michelle Kasaric, and I'm doing my very first vlog on my battle with interstitial cystitis. I was diagnosed with severe endometriosis at the age of 16. I had 9 procedures between 16 and 24 to remove endo. I had chronic pelvic pain and a lot of bleeding, and my blood wasn't clotting. When I was 22, I started free bleeding. I started losing a lot of blood, and it felt like someone was sitting on my bladder, literally. I went to many doctors. They kept pushing me to OBGYNs. They never recommended urology. When the bleeding got out of control, I started going to the hospital. They sent me to a really good GYN in Atlanta, Georgia, and he went in and treated me for the endo. Before he'd done that, he asked me if I had any urinary symptoms and made me fill out this piece of paper. I had a lot of pressure. I was peeing 50 to 60 times a day. Very uncomfortable, burning with urination. I had a lot of pain in my pelvic area. They did a potassium test on me in office and told me that I had interstitial cystitis. They began, first of all, by doing a hysterectomy on me and leaving one ovary in. They took out as much endo as they could, and then they started trying to treat the IC. They started me on Elmiron. It made my hair fall out, and I already had so much damage to my bladder with all of the pinpoint bleeding holes and the bladder spasms and the frequency that the Elmiron done nothing for me. They tried me on Elavil, Pyridium, a variety of things, birth control pills, even after I had the hysterectomy. Sorry, I'm a little nervous. So my battle began then. They put me on Urostat to try to help prevent me from getting urinary tract infections, made my urine blue. I tried that. Then within a month or two of my hysterectomy, I still had one ovary. They started doing bladder installations on me because I had constant flare-ups and horrible, excruciating pain with intercourse. I couldn't work. The bleeding had stopped, which was good. I thought that that was going to be the last of the endo, and that was my 9th surgery. However, my IC started to get out of control to the point to where they wanted me to come every other day to get a bladder installation done, which is where they put heparin and another drug similar to lidocaine into the bladder through catheter in office. It's a very expensive procedure. They make you leave it in for an hour and a half, and then you're able to release it. If you have IC, even if it's a mild case, which mine's very severe, it's very hard to hold any amount of urine in for any amount of time. I was doing 3 bladder installations a week, maxed out my insurance, and they weren't helping. I tried 10's unit shock therapy. That didn't help. I had a lot of blood in my urine. I was in pain 24/7. Heating pads. They put me on narcotic pain meds. I went to 4 or 5 different urologists. Everyone kept telling me that, you know, the pain wasn't that bad because they didn't have IC, even though they had knowledge of the disease. It's a very complex disease, and they're trying to find out more about it, but it boggles doctors' minds because they can't figure out what causes it, and the best treatment plan to help you maintain a normal life. I have been through hell and back with this disease. I've been on every medication you could think of. I've been on birth control after hysterectomy. I'm 29 years old now. I had my last ovary taken out March 20th of last year. Endo came back. I had some other complications I really don't want to talk about because they have nothing to do with IC. But I almost bled to death because my blood wasn't clotting. Throughout my journey, I've had 6 cystoscopies with hydroid distension and urethral widening. My first couple of cystos did not work. My third one worked. It worked for about 3 months. I had done the hydroid distension. The pain went down to about 50%. It was more manageable to where if I'd done certain things, my pain was worse. So I tried the diet. I tried every combination of medications. They would give me Elavil, Elmiron. I done some other antihistamines, Pyridium, Tramadol, Toradol. I had frequent urinary tract infections. And then I just kind of got to the point where it broke me down mentally, physically, emotionally. It's very debilitating, and I wouldn't wish it on my worst enemy. August of this year, I came to North Carolina prior in March. My grandmother got really sick, and I was helping my mother take care of her. And I was under a lot of stress, and I kept having IC flare-ups. I didn't have insurance. I had no idea what to do. I woke up one day, and I couldn't pee. My stomach looked like I was about 8 months pregnant. I couldn't walk. I felt like my bladder was going to explode. I got rushed to Baptist Hospital via ambulance, and they put a Foley catheter in me. It was the only way that they could get the urine out. My bladder was at full capacity. I got very, very sick. I had the Foley in for 3 weeks. I was back at the hospital every week. Every time they took the Foley out, within 3 days, my bladder would completely fail. And it started to affect my left kidney. I eventually got in with a urology clinic at Wake Forest Baptist Hospital because they're a teaching hospital, and they have free clinics for people with no insurance or Medicaid. So I started going over there, and before I had my cystoscopy done, I had a bag of blood attached to my leg through a Foley catheter leg bag. Freaked me out. Seriously. Went to the hospital. My mother went with me, and they thought I had a blood clot, and they done an irrigation catheter on me, which is the most painful thing I've ever had to endure. Pretty much what they do is get 2,500 milliliter bags of saline, hook them up like they're giving you IV fluids, and they put a catheter in, and they flush you completely out until there's no blood coming out in order to release you back. I learned how to self-cath. My boyfriend was self-cathing me. It was something that I just couldn't do myself. I just couldn't do it. He self-cathed me on a regular basis. The blood kept coming back every time I would get the bag. After they irrigated me, they had no idea what was going on. The pain was out of control, and I honestly wanted to die at that point. I thought I was going to die because of all the blood. There's nothing more scary than waking up and seeing a bag full of blood attached to your leg. They irrigated me, set up my cystoscopy. I thought it was going to be a regular cystoscopy with hydrogen and widening of my urethra, where they take rods of different sizes and stretch your urethra so that your urine comes out normally. When they went in, they found something called Hunter's ulcers, also known as Hunter's lesions. It's rare. Only 5 to 10% of IC patients develop this. They eat away at your gag layer and every layer of your bladder. I have one layer left. I am a very severe case at this point. Excuse me. Because the ulcers ate through so many layers. My bladder is shrinking. It's holding about 320 milliliters at this point, which is as much as a 3-year-old. A normal bladder holds 1,000 to 1,200 milliliters, and you go to the restroom every 3 to 4 hours. I have drops of urine come out. I have to actually push on my bladder at times just to get the urine to come out. I have a whole arsenal of catheters. I have Foley catheters, female catheters, in and out catheters, pinpoint catheters, pocket catheters. I have iodine, the lubrication to get to come in. I've had high levels of blood in my urine. So they done that cystoscopy in September. When they went in, they fulgurated, aka lasered off 20 Hunter's ulcers. The doctor said it looked like there was a bundle of grapes in my bladder that had been cut in half. He took 20 out. He said my bladder was to the point of rupturing because it was so big. There were so many in there. I thought that was the end of it. I went for my post-op, and they told me that my case was so severe, they'd never seen a case as severe as mine at the age of 29, because most females over the age of 40 accumulate interstitial cystitis. So pretty much what they told me was, we have no idea what to do with you. You don't have insurance, but there's one doctor that can save you. His name's Dr. Evans, Winston-Salem, North Carolina. I live in Greensboro. I don't have insurance. I don't have Medicaid. It's $425 to walk into the door. I am at the point to where my bladder is on its last leg, literally. It fails on a regular basis. I just recently had my last cystoscopy as an emergency procedure on January 27th. They are telling me that the only way to save my bladder or to alleviate the majority of the symptoms as a possibility, 50-50 chance, is to do a reconstruction of my bladder where they take a portion of my colon and create a layer around my bladder. That is not a guarantee that the IC symptoms won't come back. There is no guarantee with this disease. Second option is a diversion, where they take your ureters, and they take them from the bladder and connect them directly to the kidney, and I would have a tube coming out of my stomach, and I would have a bag to collect my urine, and it would alert me when it was full, and I would empty it through my belly button. They told me that within the next 3 years, if I do not have one of these procedures done, that my bladder will no longer function, and I will die. I'll bleed out. I'm 29 years old. I've tried everything they've asked me to do. I've taken every medication. I deal with it on a daily basis. It's affected me psychologically, mentally, emotionally. It's affected my relationships with everyone in my life. It's a very debilitating disease at any age, and I feel for anyone who has it. I now am going to get a second opinion shortly, because the city that I live in, Greensboro, North Carolina, offers an orange card, and there is only one urology office in the city, and I'm going to get a second opinion. Something else that comes along with interstitial cystitis is Crohn's disease and fibromyalgia. I am now having problems with my colon. They think it might be Crohn's, but I now have polyps on my colon, rectal bleeding, and I'm vomiting blood. I'm having an endoscopy and a colonoscopy done, a biopsy of my intestine or my upper GI tract, my small bowel, my colon, and my stomach lining for cancer. My white blood cells have spiked up to 1,400 right now. My red blood cell count is down to 6,000, so there's either a major infection or cancer. 14,000. I personally wish they would take my bladder out, but they refuse to. It's not something that they will do in the United States of America. Canada and the UK are very advanced in IC treatment. There's actually a doctor in Winston-Salem that created a neonatal bladder that he done a patient trial on with a 12-year-old girl in Chicago who had kidney failure, but they would not work on her kidneys and reconstruct them because of her bladder. He installed this neonatal bladder in her, and now she has perfectly functioning bladder and kidneys. The United States will not approve it, the FDA, because it is considered to be cloning. They take a cell sample from you, or a sample of your bladder, and they grow that for 6 weeks, and then they create a neonatal bladder and they install it. He has had a lot of success. He has done both of the procedures, the reconstruction and the diversion, and he has had a 100% success rate. And I don't have insurance, nor do I have the resources financially to go see this doctor. So I'm having to get a second opinion in Greensboro with the urology office down here. At this point, I have chronic pain that is gut-wrenching on a daily basis. I am being treated by my PCP and referred to a pain management clinic. I have chronic fatigue as well. I live with my heating pad. I have been deemed completely disabled because my bladder is so weak. It's affecting my colon now, my liver function. Everything is being affected by this disease. I'm hoping that the United States will eventually get more informative and more open-minded about the treatment of this disease. I've been through and exhausted every treatment, medication, and option. And my only option is major surgery that could be fatal. The surgeries that I mentioned are morbid surgeries. And I continue to try to force myself to urinate without having to self-cath. I still try to get up and do everything I do on a regular basis. The hardest thing is waking up in the morning and being in pain, even with the pain meds. Being in pain all day. I have not had one day in the last 5 years that I have not been in excruciating pain. Even with the pain meds, I take Roxy 15 milligram immediate release every 6 hours. It still doesn't help. It helps sometimes, but my flare-ups are so regular that, you know, they're going to have to change that at some point. It wasn't what I wanted. Definitely not what I expected at 24. I do the best I can to try to maintain a normal life, but it's very hard because it causes a lot of depression. It makes you feel like you're alone. There are people out there that have the same condition. It may not be as severe as mine, but I've been through hell and back with this. And I'm very open to other people's stories. And that's why I'm kind of putting mine out there. Because I've been sick for a while. And now I have a possibility of cancer somewhere in my GI tract or my colon. And I'm having that procedure on Tuesday as an emergency procedure. I went to the doctor yesterday. So I'm a part of the IC network. It's a group of really, really strong women, and men also do get IC. It's only about 2%, but they experience it as well. It does not discriminate, just like cancer doesn't, just like kidney disease, liver disease, or anything else. They don't know why you get it. They have suggestions and theories, but nothing's been proven at this point. They also believe it could be related to an autoimmune disease, which is fibromyalgia. So I just kind of wanted to put my story out there and let everybody know, my friends, my family, and anybody that's battling with this, that this very much does exist. It's not in your head. The pain is there. And I know that it's frustrating being bounced from doctor to doctor, but keep trying until you find a doctor that will listen to you and that understands. Read your reviews about the doctors you're going to see, and try to find a doctor that knows a lot about IC. Do your own research, and do the best that you can to maintain your sanity, because it is very, very hard. My disease has affected my relationships with everyone around me, just because the amount of stress and the chronic pain. If you do not know what chronic pain is, or have never experienced chronic pain, then it's very hard to understand why someone can't go to the mall with you, or why they don't feel like cooking, cleaning, getting out of bed, playing with their children, going to a movie. I can't even ride in a car and sit up straight for more than an hour. I can't stand for more than an hour. I can't sit up straight in a chair for more than an hour. I don't drink alcohol. It's toxic. I love all kinds of fruits, vegetables, chocolate, caffeine, all of that stuff. I continue to intake because even whenever I change my diet, and doctors keep saying, change your diet and do this, and, you know, they give you all these options, but they don't battle with the same disease that you do. So I know how frustrating it can be for someone who does not know, who is a urologist and has done research on this. It's frustrating with them, but it's even more frustrating with the patients. who have this disease, because it does not have a cure, and it is something that you have to live with for the rest of your life. Hopefully they will find a cure. But until they do, utilize your resources. Go to the IC network. The American Neurological Association is a good resource. You can also look up resources in your counties and states that you live in that will help you with your medications. Elmiron is very expensive. It didn't work for me, but the pharmaceutical companies offer programs for that. I also have grand mal seizures, so I'm on Klonopin. IC pain is also associated with nerve pain, and chronic pain, pelvic pain, pain with intercourse, the whole nine. So if you experience any of these, go to your doctor, whether you think you have it or not, and have the simple potassium test done, because it can make you or break you. And if you wait too long and your case gets too severe, like I did, then you will be experiencing the worst thing ever. It's affected my quality of life to the point where I'm 29, I'm disabled, can't work. Sometimes I can't get it. I get in the bathtub 3 or 4 times a day, have a heat pad attached to me. I have cystoscopies done. I was getting them done every 6 months to a year. Now I get my bladder stretched in hopes that it will hold at least 500 milliliters, and it's continuing to shrink and literally trying to kill me. So, you know, I really don't have a lot more to say, but, you know, I'm here. If you want to find me on Facebook, it's under Michelle Hargraves. I'll put it down in the comments. Friend me if you need someone to talk to, you need some help with finding resources. Become a member of the IC network. Register. The admins and the women on there are so supportive, and everyone has their own story, and this is mine. So I hope that it's helped someone out there. Thank you.